The patient is angry, they're raising their voice, they're blaming the clinic, and now everyone at the front desk can hear them. What do you say? Do you apologize? Do you explain? Do you defend yourself? In this video, I'll show you exactly how a professional medical receptionist should handle an angry patient, including what to say and how to turn a difficult conversation into a professional one. Welcome to Healthcare Skills Hub. My name is Nair. We help you build practical skills for careers in medical reception, patient support, virtual medical assistance, and today we are going to practice a realistic patient interaction. So let's begin. There is a 5-step method. Step 1 is stay calm. The first rule is simply stay calm. Even when the patient is upset, raising your voice or becoming defensive will usually make the situation worse. Keep your voice calm, professional, and respectful. Listen without interrupting. Give the patient an opportunity to explain what happened. Let them drain. Don't interrupt until and unless you need to clarify something important. Sometimes patients become more frustrated because they feel nobody is listening to them. You can say, I understand that you are upset. Please tell me what happened, and I will do my best to help you. Acknowledge the concern. You don't always have to agree with everything the patient says, but you should acknowledge their experience. I understand why the situation is frustrating, or I can see that has been a frustrating experience for you. This shows empathy without making promises you cannot keep. Step number 4 is focus on the solution. Once you have listened, when the patient is drained up, move the conversation toward a solution. Ask yourself, what can I do? What information do I need? Who can help resolve this? Let me review the situation and see what options are available. Step number 5 is follow up or escalate when necessary. Not every problem can be solved by the receptionist. If the issue requires a supervisor, manager, nurse, provider, or another department, follow your organization's escalation process. Like, for example, I would like to make sure your concern is handled by the appropriate team member. Let me connect you with the right person. So, we'll have a scenario here for the angry patient. A patient arrives for an appointment but believes that they were told they had a different appointment time. This is ridiculous. I have been waiting for weeks for this appointment and you are telling me that a doctor can't see me. The bad response will be that that's not my fault. You should have checked your appointment time. The response is likely to make the situation worse. Even if the receptionist believes the patient is mistaken, blaming the patient is not professional. What will be your professional response then? I understand that this is frustrating, especially after you have been waiting for your appointment. Let me check your appointment details and see what options are available. I have already taken time off work to come here. Okay, I understand. Let me review the schedule and see whether we can find the best available option for you. Did you notice what the receptionist did? First, he remained calm. Second, he acknowledged the patient's frustration. Third, didn't argue. Fourth, focused on finding a solution. And that's a professional de-escalation. So, a patient calls and and says that I have called 3 times and nobody has helped me. This is the worst service I have ever received. Your response could be, I'm sorry, what have had such a frustrating experience. I would like to understand what's happening and see how I can help you. Could you please tell me what you need assistance with today? I need to know why my appointment was cancelled. I understand. Let me review the appointment details or appointment information and see what details I can provide you. Patient says, well, I need this fixed today. Okay, I'll do my best to help you with the next available option. Let me check the schedule, please. Notice the language used here. I'm sorry you have had such a frustrating experience. I would like to understand what happened. Let me check. I will do my best to help you. These phrases show empathy and professionalism without making promises. You cannot guarantee. 5 things you should never say to angry patients. Number 1, calm down. This can make people feel dismissed. I understand that you are frustrated. Let me see how I can help you. Number 2, that's not my problem. Never dismiss a patient's concern. You can say, let me see who can assist you with this. Number 3, you'll have to wait. This sounds dismissive. You can say, thank you for your patience. I'm checking the information now. Number 4, I have already told you. Even if you have explained something before, remain professional, please. You can say, let me clarify that for you. There is nothing I can do. Wow. That's a nuke. Even when you cannot personally solve the problem, you can often explain the next step. Here's what I can do for you. So, if the patient says, I need to see a doctor today, you can say, I understand that you would like to be seen today. Let me check the schedule and see what options are available. I don't want another day, I need today. I understand. I will check the schedule for you. If there isn't an appointment available, I'll explain the available option to you. This is an important skill. Don't promise something you cannot guarantee. Don't argue with the patient. Explain what you can do and what the next step will be. A medical receptionist should always know when a situation goes beyond the customer services. If a patient expresses a medical emergency, threatens harm, became physically aggressive, or present another serious safety concern, follow your organization's emergency and escalation procedures and involve the appropriate trained personnel. Your role is not to diagnose a medical emergency or independently manage a dangerous situation. You have to know your limits and follow the escalation procedures. There is the LEARN method, which is LEARN. Listen, empathize, assess, respond, next step. This can become a recurring branded learning framework for healthcare skills hub. If I give you a quiz, what if a patient says, this is the worst services I have ever received? Number 1, that's not my fault. Calm down. Number 3, I understand you are frustrated. Let me see how I can help you. What is the correct answer? You can comment and let me know about it. There's one more thing. Should you promise a patient something you cannot guarantee? Is it a yes or a no? Here's something to remember when preparing for a medical receptionist interview as well. Interviewers may ask, tell me about a time you dealt with an angry customer or patient. Your strong answer should explain what happened, what you did, how you communicated with the patient or a customer, what was the outcome. This is often called the STAR method: situation, task, action, and result. So, uh, your, your answer will depend on the STAR method. Tell the situation first, then the task, what action you took, and what was the outcome, the result. So, handling an angry patient is not about winning an argument. Never. It's about staying professional, listening carefully, showing empathy, following the correct procedures, and helping the patient understand the next step. Remember the LEARN method: listen, empathize, assess, respond. Next step. The more you practice these conversations, the more confident you'll become. If this video helped you, like the video and subscribe to the Healthcare Skills Hub for more practical medical receptionist and virtual medical assistant training. And remember to watch out other lessons on patient calls, appointment scheduling, HIPAA, medical terminologies, and healthcare job interviews. Thank you for watching Healthcare Skills Hub. I will see you in the next video. Bye-bye.